I think we have to be very, very careful with the language and terminology we use. And so even when we're looking at the growth chart, say they're in the 95th percentile, if you say, well, you're 95% larger than all of your peers, like that automatically just comes off sounding kind of, stigmatizing or bad. Yeah. And so I think talking to the parents and the patient about the child about it in a way that these are markers that we look at just to see how you're growing over time. And right now it shows that you are growing consistently over time, and you're growing faster than your peers. And I think that is completely okay.
I have this mentality like you do, and then I see a patient who's coming from another clinician in my same practice who's been told more of this narrative of either being overweight, obese, or underweight. I talk about both because I see both. A lot of the families are stressed about this, right? Because they're like, well, what am I supposed to do? Because what's happening is they put the label, and then they're not giving the health education, which we'll get into, of like, what does this mean? Like, what does it mean if I'm on the higher end or just has always been on that weight and is active, eating balanced, right? The family habitus is like that. I mean, they're doing the things, right? They're not over consuming sugar, sugary drinks, all of that. We're going back to the lifestyle, right? Like, what is it that we're doing here? And that can be very stressful from the beginning.
And if they're on their normal trend, then I don't think there's other reasons to talk about diet and exercise. And even though I wouldn't use those terminology, like if they're following their trend and they're consistently large for height and weight, then that's probably that they're naturally a larger person.
Welcome back to the show. This is the PedsDocTalk podcast, and I am your host, Dr. Mona, your pediatrician, mom friend, confidant, and guide through everything child health, development, and parenting. And I'm so excited because this channel continues to grow. If you are watching this, you are on our YouTube channel, and we are actively getting up there. I started this year thinking that I was going to shut down this YouTube channel, and now we are growing, and I'm so excited because I continue to be able to give you solo education, but also bring on the most amazing guests via the podcast that we're putting on this channel. And today's guest is no different. He is one of my favorite follows. And he's one of my favorite follows on Instagram because not only does he share a lot of education, misinformation, but he just seems like a really cool, nice guy. And that is so important to me when I have guests on my show. And that is no other than Dr. Tommy Martin. He's a combined internal medicine and pediatric doctor, which many of people don't know that exists, but internal medicine and pediatrics. He's active on social media. You can find him on Facebook, TikTok, Instagram. On Instagram, Dr.Tommy But welcome to the show. I am so excited to finally virtually meet you because we've been chatting a lot. I've been following you, but obviously we've been in DMs. We talk so much about just everything in general, but thank you. I'm happy that we can finally have you on the show today.
Yeah, Dr. Mona, it is such an honor and pleasure. Like I said right before we got on the podcast, I've been following you for so long. I feel like I know you and like that we're best friends. And so it's so great to finally connect not necessarily face to face, but as close as we can get right now. So thank you so much for having me.
It feels like this. And the next step is like at a conference or some sort of event, we're going to meet and we're going to be like, hey, we've been friends forever. Like,
that's right. And we'll be able to shoot some videos together real time.
Yeah. And I know your wife is also a pediatrician, right? Not internal med pediatrics, but pediatric solo.
Correct. Yeah. She has her own practice and she does pediatrics.
So we have that connection, obviously internal med peds, married to a peds. I'm, obviously married to an ER doc. So we're that doctor couple navigating being parents, navigating being physicians in this healthcare system. And, for anyone who's not familiar with his account, which by the way, you should be now, and you're going to pause this and go follow. And all his handles will be on my caption. But I love the way you disseminate information. I love that you talk a lot about health and fitness, which today's episode, we're actually talking a lot about the medical bias hurting our kids' body image. We talk a lot about BMI. We talk a lot about these weight-based conversations that happen, especially in the outpatient world, in pediatrics and also for adults. And I love that you practice what you preach. I love that you are very physically active, that you have this history of, body image. And I know you were in a larger body at one point. I was in a very smaller body. So I think we're going to be able to have a nice conversation about how those two different things have approached our life and our practice. But tell us a little bit more about yourself. What brought you to start to make this content online and get online and be that presence?
Yeah, of course. I think we can definitely talk a lot about this, having differing backgrounds, but also kind of maybe some of the same issues. And so,
Yeah.
growing up, I really struggled with my weight, and truthfully, my whole family still continues to struggle with their weight, and I probably would if I wasn't as active as I currently am. And so, growing up, coming from a family of poverty, we didn't have a lot of money. My Neither of my parents graduated high school, but they're like the hardest working people I've ever met in my entire life. They're incredible humans. But with that, there wasn't a lot of knowledge about what good foods are
Yeah.
to eat or healthy and nutritious foods. I shouldn't use the word good. I do not like to label foods good or bad, but nutritious foods. And so a lot of the foods that we ate were very calorically dense
Yeah.
and not very nutritionally dense. And so that led to me living in a larger body for the majority of my childhood. And that was extremely hard for me. And so if you look at a lot of my content today, it is advocating for either children or adults that maybe struggle with their weight and that are feeling the stigma and the bias from not only the medical system, but the entire world. Anywhere you look on social media, you can find videos of people who live in a larger body that are getting made fun of or that are having terrible comments in their comment section about what they're doing or how they exercise, what they eat, and things of that nature. And so I think the trauma that I experienced as a child has kind of led me into some of the content I create regarding those things.
Oh, I love when people have a story and use that story for good. It's one of my favorite things in this world, right? We have this experience. For me, I think a lot about my birth trauma and that experience and how using that has really shaped my role as a pediatrician and a mother, and how I disseminate education to new moms who may or may not have trauma. What kind of messages did you receive from doctors, family, or socially? And maybe we can start with that doctors, because this episode I really want to talk about how the medical system can really negatively impact body image, and when we talk about weight. But did you get those messages from doctors or medical facilities about your weight and how that really impacted you?
Yeah, truthfully, I do not believe I personally did. A
Okay.
lot of my doctor's encounters, I think, were probably pretty short and didn't experience it too much. But I have seen, I think my sister had quite a few comments from physicians, and I've seen other children have comments from physicians. And I think one of the things is like when a child goes to the doctor, one of the first things they do is step on the scale. Right. And I
Yes.
think that immediately just centers the visit around weight, especially if it's someone that struggles with their weight. Even if the visit isn't supposed to be about that, just the fact that that's the first thing in the encounter, someone who struggles with their weight, that's probably what their mind's going to go to, right? And
Yeah.
already start feeling bad about themselves because they had to weigh the first time going into the room. And so I think that, and then on top of, physicians talking about BMI and a child's BMI and being in the obese category, or extremely or like overweight. I think all of those terminologies and those words can be hurtful, even if they're not meant to be. And then I think the way that a physician talks about them, so instead of talking about, well, you don't need to eat X, Y, and Z, or, you shouldn't be eating that much, or just different ways that they go about talking about it could be really stigmatizing. And I think put a lot of the blame on the person, instead of finding ways to kind of navigate the situation to be more uplifting rather than blaming the person for their size.
Yeah, and we're going to get into some tips that I think you have, I have, and how I envision approaching these conversations in my office. Obviously, I think both of us realize that health is important. So
Mhm.
it's not to say that we are allowing people in smaller bodies, larger bodies to just do whatever they want with nutrition and not exercise. This is so much more than that. And
Yeah.
I think that can sometimes get lost. I think I am a very big proponent also on body image and loving our bodies and teaching how our children from a young age to love our bodies. So the phrases we use, not only in medical systems, but with parents, right? Like how we talk at
1000%.
holidays and how we talk at the dinner table. Like all of that really matters, because loving yourself, including your body, is such an important thing that kids need to realize. And if any of this messaging gets under our skin, like that you don't need to be doing this, or why are you doing this, and if it's a shame filled thing, it becomes we can't have more of an impact, right? Like when there's shame in the driver's seat, driving that education.
Yeah, for sure. And I think that it could be a repetitive cycle, right? So
Yeah.
like they hear these things, they feel bad about themselves, then they go to eating as like a comfort measure. They hear more of these things and it just kind of repeats this cycle. But I did want to answer your question about some of the comments that I had as a child that maybe necessarily wasn't just from a doctor, but from peers, loved ones that maybe they didn't even realize that they were hurtful, but they were hurtful. And so comments just as simple as, are you really going to eat that? Or
Mm,
do you sure you need? Are you sure that you need another helping? Are you sure you should go up for seconds? So those are like comments that maybe my loved ones, my family members would say at events or gatherings, and just talking about like the quantity of food that I was eating in a dismissive way, and that is hurtful. Or are you sure you should eat ice cream? Are you sure you should eat a piece of cake? Like whereas if someone in a smaller body is eating a piece of cake or ice cream after dinner, they don't say a word, right? But as
yeah.
soon as someone larger does, then it's this terrible thing. And that's something we see on social media a lot, as well as when we see these like what I eat in a day videos. If it's someone that is in a larger body, regardless, they could eat 99% whole foods, but if they have one treat or something during the day, like the comment section would just be filled with shame and blame about that person's weight because that one thing that they ate. So I'd say that those were some of the comments that I received from my family members. But then from my peers would be, being called fat. If I were to go to, like, say, the pool with my
Yeah.
friends and have my shirt off, which I would never do because I was so ashamed, but they would talk about like the size of my chest or the size of my stomach, or maybe if I had stretch marks on my stomach, and like just constantly making those comments about my size and about my body.
And that's so hurtful. I mean, especially any age, especially from a young age when a child is developing that self worth and developing that identity, and having that identity tied to their body image, right? And I know you've spoken about that, like tying worth to appearance is such a harmful thing, not only for weight but also for looks, right? Like, oh, you are just so pretty, you're so cute, all that stuff. And I mean, kids are cute, right? We say that, but their value should not be tied to like, oh, that pretty dress, or you look like this. Like, it's such a metric about appearance, which can be really harmful. And I mean, my story is obviously from another perspective, knowing that, yes, I want to be very clear before I get into my story that society still does that sort of discrimination about the what you mentioned perfectly. Like if a larger body person has an M&M, it's like, oh, well, if a smaller body person does all the same thing, has an M&M, they're like, oh, look at that balance. Look at that,
Yeah.
look at that balance that that person is just, getting to enjoy. But you're right. Now, what happened being in a smaller frame, as well as my husband, who's a male, and I'm going to speak to both of our experiences. It's the smaller body ended up at those parties being like, you're not eating enough. Are you okay? Are you stressed? Eat more, eat more. So also in an unhealthy way, I didn't listen to my fullness cues, right? I started
Mhm.
getting disordered eating in that I would eat very high carb, high processed foods in the thought that that was what's going to make me gain weight. Right.
Mhm.
So I leaned on a lot of carbs. I didn't look at the health value of these foods. I would eat like loaded tater tots thinking, well, this will add on fat to my body. But that's not good to eat, right? Like we have to
Yeah.
think about like, yes, and once in a while it's fine, but is that my main meal? And I look at that by my 20s, I had high cholesterol because of the impact of you need to eat more. You're not eating enough. You're so skinny. I still remember like I did track in high school and the commentary like I got when I won a best like most improved award from my coach in front of everybody. He's like making jokes about how I'm surprised the wind didn't blow her over because of how thin I was, right? And to the same effect, that has a huge impact on how I viewed my body as this weak,
Yeah.
not capable body, right? That I was very skinny, like thin. Like I was literally what people would describe as gaunt, skin and bones. And
Mhm.
no boy is ever going to love you because you don't have any curves. And that I offer this perspective because we focus a lot on larger bodies, and I think there's obviously some societal stigma that doesn't exist for people in smaller bodies. But kids are listening to those messages, whether you're in a larger or whether you are in a smaller body. And I see it in my office. So it's really like it's a very nuanced conversation, but I see those body image struggles all spectrums, right? And the messages that come across, regardless of any body type, it's so stressful, right? And in the smaller bodies, it's the you need to eat more or the pressure to eat, like the finish your plate club. And I see that in my peers who have petite young children that are like, you got to finish your plate, but we know that that's not healthy. As,
Right.
as unhealthy as it is to tell someone, well, why are you eating that? Like you shouldn't be eating that cake. Like controlling what people are putting in and out of their mouth, like when it comes to food, and saying you can eat that, and that's when it goes back to holding these foods to standards, right? Like, and in smaller body people, it's almost like you don't care because you're like, just get the calories in. But it
Right.
does matter. Like, you should be
Hmm.
eating protein, you should be having balanced food. I should not be stuffing my body full of chips and sugar and soda all day, because in the thought that, well, I need to gain weight and this is what's going to gain me the weight. That's not healthy weight, right? So that is just a perspective that I love that we get to talk about, because it's a spectrum of like, just stop talking about people's bodies. Like,
Yeah,
it's not,
one like, I could not agree more, and I'm so glad that you brought that up because you're correct, and unfortunately, the society we live in today, like, your body will never be good enough, right? And
yes,
so, like,
yes.
for my journey, so I was very overweight as a kid, and then I got made fun of all the time for being fat, and I was like, "You know what? I'm sick of getting made fun of for being fat. I'm gonna lose a lot of weight." So over a summer, I went from weighing about 180 pounds down to 129, I
Oh,
think is the
wow. In
lowest that I
summer.
got. So and truthfully unhealthy. Like, it was very
Yeah.
unhealthy. All I ate was grilled chicken and cheese. Like, that's pretty much like what I ate every single day for 3 meals a day, and I would lift every single day. And so I went from being 180 pounds to 129 and lost a ton of weight. Well, then when football started up that fall, my coach said, "What in the world happened to you? Like, you're way too small. Like, you'll never play football. You can't play football being that size." And then so I was now like, well, I wasn't good enough at being larger. Now I'm not good enough being too small. So then I was like, okay, then I need to lift weights all the time.
Yeah.
And so it just continually shifted the paradigm of me not being good enough, my body being the standard that is set that needs to be of whatever everybody else thinks it needs to be. And I need to strive to achieve that. And every time I would achieve it, it was still not good enough. And so I think an important message is that your body does not dictate your worth, and
Yeah.
your body does not dictate your value. And do not let societal standards put that value or worth tag on you and you try to achieve it, because it will never work. It'll never happen. And your worth is not tied to your body.
I think we can end the episode there. What a message. What a message. No, we're not, because I have a lot to talk about. But I love that. I feel the same way. And I think, that's why when we were chatting about what to talk about, I was like, Tommy, we could talk about like so many different things. But I love that you always talk about this sort of, how we speak about ourselves and how we speak about our body. I think it's just so valuable. And this goes down to teaching this from a very young age, right? And, you brought up at the beginning that the first thing that we do is we get on that scale. I know a lot of our listeners who may have been pregnant at some point felt that same stress, like when you're pregnant and your body has already changed, and you yourself may be struggling with the fact that your body looks different, can't move like it used to move, and all of that. And then you get on that scale and you see the 50-pound weight gain or the 20-pound weight gain. There's so much anxiety and there's so much feeling of like, well, why is this the first thing that I'm doing when I walk in here? And I want
Right.
to I want to just really be clear about that in general. In pediatrics, so like obviously I'm dealing with kids up till 21. The weight weighing is really only useful under the age of under the weight of like 44 pounds, when we need to know weight based dosing, right? Like, that's because a lot of medications are weight based, right? So it's a nice way for us to know what is going to be your weight so that we can calculate dosing. Really, besides that, I like to have that weight to be able to trend what was going on for the child right before. So it's not like, I don't care if the child's on the 98th percentile, like 5th percentile. I just want to know, are we showing any sort of stark increases, stark drops in the weight? Because that can be indicative of like thyroid disorders or, an eating disorder, things like that. So it's those drastic things. So we'll kind of get into it in a little bit about like, if you don't want to be weighed, how to approach that. But knowing all of this information, you're now caring for both kids and adults. So you see the whole spectrum. How did your own childhood experience shape how you talk about weight, health, and body image with your patients today? And did that look different than how you were trained to talk about weight with your patients?
Yeah, I think it has shaped 1000% every word that I speak in a visit with, whether that be a child who may be struggling with their weight in their family or an adult patient who's struggling with their weight. So there's a couple things that I do to start with, and that would be, let's say it's an adult patient. An adult patient, first I will, talk to them about their visit. One, if they do not want to weigh, if it's not absolutely pertinent to the visit, then that's completely up to them. And so I won't make them weigh. Their medications are not weight-based dosing, and so unless it's like actually pertinent to the visit, I do not think weighing is absolutely necessary. And then the second part of that would be, and disclaimer, I do inpatient medicine. So a lot of my stuff doesn't involve weighing anyway, but weight still may come up in the conversation. So a lot of what I'm talking about is when I was in residency doing outpatient clinics. So then after we talk about why the patient was there for, and whether it has to do with weight or doesn't have to do with weight, once we get to a good place for me to talk to them about it, I'll say, and are you interested in talking about your weight today, or how do you feel about your weight?
Yeah.
And depending on the answers to those questions, they may say, I feel great and I do not want to talk about it. And that's completely okay. And my response to that is, well, that's fantastic. If there is ever a time that you want to talk about it or you feel differently about it and want to know how it could or could not impact your health, I'm more than happy to talk to you about it. But please feel no pressure whatsoever. And so, allowing them to talk about it when they're ready. And because I feel like physicians pressuring and making patients talk about it when they're not in the space or headspace to talk about it, I think is just more detrimental than helpful. And then for children, I think we have to be very, very careful with the language and terminology we use. And so even when we're looking at the growth chart, saying that they are, say they're in the 95th percentile. If you say, well, you're 95% larger than all of your peers, like that automatically just comes off sounding kind of stigmatizing or
Yeah.
bad. And so I think talking to the parents and the patient about the child about it in a way that these are markers that we look at just to see how you're growing over time. And right now it shows that you are growing consistently over time and you're growing faster than your peers. And I think that is completely okay. And if they're on their normal trend, then I don't think there's other reasons to talk about, diet and exercise. And even though I wouldn't use those terminology, like if they're following their trend and they're consistently large for height and weight, then that's
Yes.
probably that they're naturally a larger person.
Yeah, and I love that you brought that up because it is there's been many times in my outpatient world because I'm only outpatient, right? That I I have this mentality like you do, and then I see a patient who's coming from another clinician in my same practice who's been told more of this narrative of either being overweight, obese, or underweight. I talk about both because I see both. And then a lot of the families are stressed about this, right? Because they're like, well, what am I supposed to do? Because what's happening is they put the label and then
Yep.
they're not giving the health education, which we'll get into, of like, what does this mean? Like, what does it mean if I'm on the higher end? And is it even something to be concerned about? Like you said, if that child has always been the 98th percentile and is also a larger, taller body, or just has always been on that weight and is active, eating balanced, right? The family habitus is like that. I mean, they're doing the things, right? They're not over consuming sugar, sugary drinks, all of that. We're going back to the lifestyle, right? Like, what is it that we're doing here? And that can be very stressful from the beginning. And a lot of you brought up curves and BMI, and I think we could spend a lot of time talking about that. By the way, I am going to have a YouTube video, if not already debuted by the time this episode airs, about a deeper dive into the percentiles, what they mean, BMI. But for now, like, BMI is still used in some places. It has major
Yeah.
limitations. What do you wish more parents would understand about the limitations of BMI, especially when it comes to growing bodies?
Yeah, of course. So the first thing we need to know is that BMI is not an individual stat, right? Like, so
Mhm.
BMI is designed to be used for population studies, and it
Yeah.
helps us look at very large groups of people using a standard number to kind of gauge size and distribution throughout a population. Using on an individual person can be, like, as you said, there's a lot of variables that make it not the best tool to use. And so BMI is a tool, it is not the only tool. So it is something that we use alongside of multiple other characteristics of the patient and their values, and should not be used alone. So some of the limitations would be muscle mass.
Yeah.
Children or adults that have much larger muscle mass, their BMI is going to be drastic. It's going to be extremely, inaccurate in terms of like their overall health. It also does not necessarily account for just larger bodies in general and fat distribution. And so what I mean by that is, like, say that you have someone that is very large, just height, weight, and everything. They have a good amount of muscle mass, but they have very low amount of abdominal adipose tissue.
Yeah.
Well, their BMI will still likely show that it's larger, even though their fat distribution does not necessarily show for metabolic disease. So that's a limitation as well. And so I think BMI is an okay tool, but I don't think it should be the only tool that we should use. And again, it has its limitations. And so when talking to families about it, I don't even know if I mention BMI that often, but rather just talk about growth in general. Now, not saying that BMI should never be mentioned or never be talked about. I just think that it's important to know its limitations. And so as a parent, or as, as someone that's looking after a child, if your physician is just talking about BMI, it's completely okay to ask them other questions about how they believe that BMI is affecting their child. And if it is, or what other variables make them think that the elevated BMI number could potentially be harmful to the health of the child.
Oh, I love how you frame that, especially talking about the lack of looking at muscle mass. And then we know that from just the way that it was created back in, I think I looked it up, the 1830s by a mathematician, not a physician, kind of looking again at a ratio, right? And it
Yeah.
doesn't account for things like muscle mass, which is why sometimes we talk about how it can be racially biased, right? Looking at Black or African American bodies, they tend to have a lot more muscle mass just from being blessed with that. And that can trigger up a higher BMI when they don't have adipose tissue, like you said, abdominal obesity, things like that. That can be a predictor for, things down the line like diabetes or cholesterol, things like that. And so it really isn't representative of the entire population. And it sure as heck does not show genetic variability, ethnic variability. And I speak to my Indian crowd because Indian women and Indian kids are very lean. Like many of us are built very lean. Even if we try to do all the weightlifting, which I'm doing, I'm still very lean. And society can say that's awesome. That's great. But I still come back underweight. Like
Yeah.
I'm always listed as underweight, and my kids also are listed as underweight, even though they are so active, going outside. And that also gets that sort of, hey, scrawny, hey, da da da. Like again, going back to this terminology that's equally to me as hurtful as other terminology for kids that
Exactly.
get larger bodies, right? The end converse, like my final point of all this is, why are we just talking about bodies at all? Like, there's no need. Like, if something's coming up in your lips and you're like, oh, I want to comment on that, how that person looks, just shut it down. Shut it down.
Shut it down.
There is nothing, you're not adding any value by saying, you're so scrawny. You shouldn't eat that pie. You should eat this. Like, you don't have any say. Um,
Right. Yeah.
even
I
yeah,
love that.
even the 2023 AAP guidelines, by the way, on obesity noted that BMI is an imperfect proxy for adipoticity and
Yep.
risk and racial ethnic differences in a body composition. So we know, like you said perfectly, that there are limitations to this. Is it useful in some cases? Yes, maybe looking at tracking if there's a very high, obesity concern where we're trying to really impact health. But then it also goes back to, how are we having those conversations? We're not just putting that person's value with the BMI or with the number and saying, well, we need to get your BMI or weight down to X, Y, and Z. That's never going to work. Like, it's like the cardinal rule of me, if I'm going to talk about health, when parents come in and they're like, what weight should my child be? And I'm like, no, 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 no. We're not going to talk about that.
Yeah.
We're going to talk about health and lifestyle. What are we drinking? What do our meals look like? Do we need a nutritionist? Are you able to move your body? Speaking about access, do you have access somewhere to move your body? Like, do you have access to parks? Because some of my community does not have safe access to
Hmm.
outdoor activities. So it's important to understand context, and that, like you said earlier, Tommy, that it's not a sign of failure. It's not a sign of anything more than sometimes it's circumstantial that we're not able to also have the ability to go outside and exercise, or access to the healthy, balanced education of nutrition that I think everyone should get about not consuming high sugar drinks, and also what is on our plates, right? Are we incorporating proteins and health, like carbs? And it's not just about, let's do packaged foods, processed foods. And it's that conversation I think we need to have more of.
Yeah, I couldn't agree more. But I want to ask you a question. But before I do so, I want to make a point that, when we talk about weight in general and body size, something that we should understand as parents, as physicians, and just the general public is genetics play a huge role in
Yeah.
this. Okay. And so when people say, well, just don't eat so much, or just stop eating that, or, comments like that, well, people have to understand that we're not all playing on the same playing field. And our genetics and our hormonal regulation throughout our bodies are very different. And
Yeah.
so someone who may not struggle at all to maybe, when they're full, to stop eating, someone else may have an extremely, extremely hard time to stop eating, even if their body cues are maybe saying that they're a little bit full. And a lot of that come from genetics. Another kind of hot topic in the obesity space is food noise. We know
Hmm.
that some people experience severe food noise. And for people that do not know what that means, that is like this unrelenting noise inside your mind that is making you think of eating food. Whereas some people just don't have that noise. They just do not have those thoughts. And so, one example, and I struggle with food noise extremely bad, would be, let's say my wife and I go out to dinner and she doesn't eat all of her food, but I eat all of mine. My mind cannot stop thinking about eating her food until either it's taken away off the table or until I eat it. And I will eat it until it's gone. And some people do not struggle with that at all. And a lot of people who suffer with obesity as a chronic medical disease suffer with that continually. And I remember even as a young child not being able to stop thinking about food. And so I want people to know that not everyone is playing on the same playing field. And just because your kid struggles with their weight, it does not mean that they lack willpower. It does not mean they lack motivation. It does not mean that something is wrong with them. It just means that their body is made up differently than maybe some of their peers who do not struggle with overeating or regulatory appetite regulation.
You were the first person who taught me that term. I watched one of your videos, and I mean, sounds like a term that I should know, like that. It's such a simple term, but that food noise term, I was like, oh my gosh, like that's amazing. And one of the videos I had seen, because you're also very educational about GLP-1s, right? Like things
Yeah,
like Ozempic and Manjaro, and I'm also very interested in how beneficial it can be in conjunction with healthy
for
lifestyle and
sure.
exercise, and you talked about that too. And I there's a lot of stigma around GLP-1s, like so much so that I'm like, and it's interesting that I think most physicians I know understand the benefit, right? We see it because
Yeah,
I know a lot of people on it, or I have this education of being like, no, it makes sense when you can maybe shut down that food noise because
yeah.
I think you had posted a video about how that can help. Obviously, GLP-1s are not for kids, but that's beyond the point. But it is something that's very useful to understand and destigmatize because it is not like an even playing field. Do you think that food noise? Do we have any idea where that food noise may come from? Is that something that comes through maybe an unhealthy relationship with food? Are people just kind of like developing that? If we don't have any idea, that's fine. But I'm curious if we know how that can develop.
Yeah, research is still going on about
Yeah.
it, and it likely does involve um, um, the GLP-1 like hormone, or
Yes.
incretin. And so we know that some people just at baseline will have more food noise than others. Now there are things that we know can impact that. So lack of sleep, increased stress, so like lifestyle things can impact that, but that doesn't tell the whole story because we know that we still have people who get plenty of sleep, who are not stressed, who exercise regularly and still struggle with food noise and struggle with their weight. And so I think as more research goes on, we'll know a lot more about it. But lifestyle changes can help with that. But even if you're doing everything, perfectly, some people may still struggle with that. So even when I get enough sleep, which is rare, but even when I get enough sleep and, do all these things and I'm like a stress-free person, I still struggle severely with food noise. And
Yeah.
so I think as the research goes on, we will learn a lot more about it. But to say, lifestyle modifications should be paramount. That should be the foundation of everything when we talk about health. Medications and other things, surgical procedures, those are down the road when lifestyle modifications fail and when we cannot maintain weight neutrality and a weight that helps with metabolic dysfunction. Then those other resources are available to help achieve a healthy weight.
Yeah, I love that. And so again, follow Dr. Tommy Martin because again, we're talking about so much of what's the advancements in the adult world. Obviously, he is inpatient looking at adults and children, but I just love this, breadth of knowledge that he provides, and I cannot wait to learn more through you.
Well,
If I can't get the
thank you.
information myself.
And
Now,
I will
yeah,
say it's a little controversial, and
yeah.
we don't have to go into it because it's probably getting in the weeds, and I still want to ask you a question, but um, GLP-1 agonists have been studied in children. And so it also shows that they have been safe and
Oh,
efficacious
interesting.
in
Amazing.
children.
Yeah.
And so there are some places that are early adopters of using GLP-1 agonists in children. Now, again, this is very controversial. And so if you're like, I cannot believe that they're saying these kids should be on these shots. Well, one, know that there are oral options as well. But at the same time, I would just preface this by saying, in what world does it make sense that if we know obesity is a chronic medical disease and we are trying our hardest with diet and lifestyle changes to achieve weight neutrality and a healthy weight, but that we still cannot do it, that we withhold appropriate treatment options from our children when we allow our adults to take them. So
Yeah.
that's the last thing I'll say, but I will say it's a controversial topic. More research will be coming out, and don't flood the comments with negativity
No,
about it.
well, this
But
is so helpful because I didn't know that, right? I was like,
yeah,
oh, like that, but that makes sense because again, I see a positive benefit in adults, and I see like I have peers who are on it, and I see wow, and they're living happier lives as well. Like when the weight comes off and they're still able to balance it with the nutrition and with the exercise, they're happy. Like, and I want
yeah,
people to feel happy about their bodies, and
right,
I want people to feel healthier. And like you said, obesity is a chronic issue, and if they've been doing all the things it's an assistant. So let's get back to.
for
I know
sure.
you have another question, but
Yeah.
does that?
So
Yeah, go ahead.
what I wanted to ask you is, let's say that we have a child in our clinic, right, and their weight percentile is much higher than their height percentile, right? And so that this is showing that maybe this kid is struggling with their weight and it could impact their health later on, whether that be elevated liver enzymes or metabolic dysfunction, elevated A1C. And let's say that you wanted just to see, and the parents were okay getting those labs, and the A1C is borderline, so almost pre-diabetic, and the LFTs are slightly bumped a little bit. How do you, and I mean, you obviously could turn and ask me this question as well. What are ways that you talk to the family about this? Like, this could be such a
Yeah.
hard topic. And then is there an age range where you're like, you know what, I feel comfortable talking to the child directly about this as well, and the parents, or, vice versa? We should probably just talk to the parents about this. I think they're a little too young to understand what's going on.
There's a few phrases and few things, and you already alluded to it about like not approaching it from a shameful way, right? So this is a huge thing because I often talk about body image, and then I get some endocrinologists, some doctors who are like, how can we just not talk about it? Like it's a
Yeah.
thing, like it's their health. And I said, this is not about denying that it can become a health issue, like you said, like high cholesterol, obviously heart disease, things like that. So if a child truly has a health concern, meaning I'm
Yeah.
worried that we've maybe, let's talk about if they've gone too high up on from visit to visit. And I saw that a lot in the pandemic over the summer, children who jumped like
Hmm.
40
Oh my
pounds
gosh.
in
Yeah.
the summer because they were home, they weren't doing anything like active. And I know,
Hmm.
and the conversation I have first is, hey, and it's usually talking to both of them. And depending on the child's age, I'm talking to the parent, maybe like eye contact wise. And I say, hey, I want to talk about your health, not about weight. So the first question is, let's talk about your health. How are you feeling? And like I talk about like how they feel mentally, physically. That just sets the tone that I care about their physical and mental health.
Yep.
And then I do actually turn the percentile curve to them to show the trends. So because I care more about trends than I do percentile. So then first I say, hey, look, I don't really care that your child is on this number or this number, but I want to show you how we've kind of grown in the last 3 months, right? So in the last 3 months, we've kind of jumped a little bit here. And my question to you is, do we feel like there's any changes that have been made? Stress? Has there been less exercise? Has there been, different type of diet? So we're opening now the conversation about the lifestyle, right? So that is what we're talking about. And then I always talk about how these are important conversations I have with all body types. That
Hmm.
I think it's really important because I find that we tend to think that it's only the larger bodied children that are drinking the sugary drinks and the
Right.
unhealthy. But I can tell you, as someone who is in a smaller body, I needed those conversations too, right? Like,
Hmm.
it's not healthy for me to be drinking sugary drinks and like all that stuff all the time on a regular basis. So I talk about how in any body type, one of the most important things that I need to hear is what are we doing to support that health, right? And I go back to what I had said earlier about how some parents are like, what weight do we need to get to? And I say, I don't have a number I want your child to get to. What I want to focus on is we are making goals on lifestyle. So if the child is drinking a lot of sugary drinks, right? Because that is usually one of the biggest things that I see in children when we're talking about nutrition. I say, I know that you love your soda. I don't say
Hmm.
just get rid of it. I say, I know you love your soda. How can we remove that slowly? Maybe instead of every day, we are going to go to every other day, or maybe we go to special occasions like when we go out to dinner or a party, and we come up with like a team approach of like, how are we going to reduce that volume? Or when it comes to food, I'm not a nutritionist, so I always offer nutrition education like with a
Hmm.
specialist. I'm saying one of the beautiful things about this is that we can really get to be able to incorporate some of his or her favorites with all these other foods, right? Because I don't believe that we go cold turkey and say, get it all out now, do all this now, because they had a desire for that. Their food noise, if they have it, is going
Mhm.
to be like, I need that sugar or I need that cookie. But we talk about what are some baby steps we can make, and do we want a nutritionist? And then I talk about how my goal here is health and not numbers. My goal is that we can get your child so that we can make sure that their cholesterol levels go down. And I do believe that we can do that with the healthy education about nutrition, lifestyle, all of that. And I think when we approach it from a level of I'm on your team, that I'm not your enemy, I'm not trying to tell you, I'm not coming from a place of shame. I'm not coming from a place of how come you're not doing that? It's from a place of I know you're capable of doing all these lifestyle changes. And I
Mhm.
also incorporate the parents too. And I say, Mom, Dad, I want you to get on board with this too. I think it's important for your health as well, that we think about, how can we approach the exercise, the nutrition, the drinks that we're drinking, the snacking, right? Because all of that are little things that we may not think about that can add to the health of us. And I always go back to the fact that every clinician should be having these same conversations with all children, regardless of how their body looks. And I think that's where
Amen.
the stigma comes in. The stigma comes in is that we tend to only talk about it if the weight's high. But
Right. Or severely low or whatever it may be. Right. Yeah.
yeah, but we should,
Yeah.
and even so, going back to the undereat, like the underweight philosophy is the forcing of the food, right? Like the forcing of the food is something I commonly see in lower weighted children, which is
Yeah.
not healthy because then they grow up with disordered eating that they don't listen to their cues. And
Mhm.
so then I see the child whose family may be on the larger end, like the child's on the larger end, and they are forcing food because culturally, like I think about a lot of my cultural families, and I'm going to throw this in, my Latina families, they
Mhm.
love their children to be
To
well
be
fed. They
Yep.
want their children that's how they show their love. But I
Yep.
also want to remind them that love can be showed in different ways, but that
Mhm.
we also have to not force them to finish their plate or force them. And then they're coming in. Some of those kids are coming in with larger bodies and dealing with childhood obesity or diabetes from a young age. So this is not a conversation about that we don't care about the health. I absolutely care about diabetes at a young age, high cholesterol, heart disease down the line. But it's approaching from a place of less shame. It's having that teammate approach on what are we going to do and what's our next step. Like we're going to do like reduction of sugary drinks. I want to see you guys in 3 months. We may weigh you, but I want to be clear that this is not the goal to get down to a certain weight. So please do not weigh yourself at home. Please don't fixate on the fact that I didn't lose the weight in 2 weeks, because that is when, as you and I both know with weight loss, that is when the psychology comes in and you think that you failed and then you go back to your old ways, right? Oh my
Yep.
God, I've been making all these changes and I'm still the same weight, or I gained weight. This is a
Mhm.
failure. And then now you're like, F it. I'm going to go back to doing what I was doing. And I always say, focus on the big steps here.
Yep.
Focus on, we are going to reduce this. We are going to increase our physical activity. Here are some indoor physical activity things that we can do. And the biggest gripe I have about all this is that in general pediatrics, I know all this information, but I don't have all the time in the world to be able to
Just
educate this, which is why
Mhm.
I have podcasts like this, right? Which is why I had to create it, because I was like, I know what I want to tell these families.
Yeah.
I want to educate them on lifestyle and what that means to me. It doesn't mean you're on a number on a scale that is like, awesome, you met that weight, because that's when failure is going to. And I've had so many situations where parents are like, I need to get him down to a certain weight. I'm like, I'm not going to help you do that. What I can help you is how are we going to approach lifestyle and how are we going to re-establish a healthy relationship with food for that child in front of you? Because that to me is what's going to help the most in body image, right? That the child doesn't look at food as an enemy. It looks at food as this is what's going to heal my body, or this is what's going to make me feel good, because sugar is yummy. Like, I don't want the kid to remove cakes and sweets, because I love cakes and sweets. And I think when we vilify and, like you said, put things as good and bad in platforms, we create this sort of mentality that, yeah, you're this way with your body because you ate this. And that's such a stigma. And it's so
Right.
hurtful. Yeah. But
Yeah,
I'd love
there
to
were
hear
so
your
many
thoughts too. Yeah.
Yeah, there are so many things you said in that I think were just so valuable. One big takeaway that I just loved was like the example of someone drinking soda, and instead of like completely eliminating it, having it every other day, or having it as, when you go out to dinner or something like that. Because, what that does is, what people do not realize is, if that is something that you're having every day, even just that reduction is going to make a huge difference. Like,
Yeah.
you do not have to make these like black and white um cold turkey decisions. Like, small changes can have an astronomical impact in your life. And so I just love that example. And something that I also ask my kiddos, and even adults for that matters, what would you like your body to be able to do?
Yeah.
And depending, a lot of kids will, I want to be good at soccer. I want to be good at football. I want to, do these things. I want to be able to, run real fast, or whatever it may be. And then to talk about, their nutrition habits and their exercise habits to achieve certain goals, and to make their body do incredible things, rather than reducing their body to a certain size or gaining their body to a certain size, rather fueling it to be able to perform in the way they want it to. And
Yeah.
not only in just athletics, it could be in school. Are you feeling tired all the time in school? Are you, having to take a nap as soon as you get home? Or do you not feel good throughout the day? And so making sure that we're thinking of our body, and like, how can we help our body perform the best in academics and athletics and performance and all of these things. And then approaching it from, well, is there anything in your current nutrition that you feel maybe isn't fueling it, or giving it the nutrients it needs to perform the way that you want it to? And then allowing them to kind of tell me what those things may be, and then asking them, are there ways that you think we could change it to help fuel your body better? And they may have no idea, and that's where we have the opportunity to talk to them about the benefits of fruits and vegetables and protein and lean meats and things of that nature. The other aspect I always bring up when we're talking about lifestyle changes is sleep. And I'm a hypocrite in saying this because I do not get enough sleep, but um, at a young age and all throughout childhood, adolescence, going into college, and even as an adult, sleep is extremely important for hunger regulation and for
Yeah.
recovery. And if we're not getting adequate good sleep, it is definitely going to throw off our hunger hormones, ghrelin and leptin. And when those are out of whack, you could try as hard as you want, but it could be nearly impossible to maintain weight neutrality and control your eating.
Yeah, I love what you say about that. And for my, one for all the parents listening, one of the biggest things is how we speak about that. Like whenever my son is sick, whenever my son is dealing with something and then he starts to feel better, I always remind him, I'm like, do you know why you're feeling better? It's because you slept. It's
Yeah.
because you ate a varied diet, right? Meaning it's like reminding them that we are feeling better in illness and health because of the things that we do for our life. So that he always understands that, sleep is important, eating variety is important. Obviously these things are real. So it's such, I love that you say that because it is about what do you want your body to do, the functionality. And I'm very into functional fitness. So I have a personal trainer. I'm very blessed to have him, and we focus on function. Like, how is your body capable of moving? What are you able to do versus he doesn't want scales. We don't do weigh-ins. There's no like aesthetic demands, but that ended up coming, if that made sense, like through the lifestyle and the focusing on the body function and how it makes me feel. It's really healthy. And it is, I believe, and I know this, but eating processed foods every day is not going to make us feel good. And I think anyone can say that. Like, if you are eating processed foods every single day, you are not going to feel as energetic, clear as eating varied diet every day, right? Like, if you're not drinking water, you're going to feel that same thing. But focusing on, like, I love this. I love eating my Takis, or I love eating my Flamin' Hot Cheetos, but some days I'm not going to eat it because I want to eat something different. And like, our approach matters too, like how we destigmatize that. With our time left, I have a question for you about like how other ways that you think this weight bias shows up in healthcare settings. We talked about how the BMI, but do you think it shows up in any other way, like in terms of like how we talk to the families or the stigma or things like that?
Oh, 1000%. I
Yeah.
think, unfortunately, because of the stigma that society has given people living in a larger body or a much smaller body, that can shape the entire conversation. So, for example, let's say that we have a kid that comes in with knee pain, and this kid happens to be in the 99th percentile. Whether it be true or not true, and for a kid, I'd say maybe not true. I think that physicians would have bias to say, well, if you lose weight, maybe your knees wouldn't hurt.
Mm, Hmm.
Like I've heard that so often. Or if you lose weight, maybe your back wouldn't hurt. And I think physicians anchoring on those um, concepts are not only extremely stigmatizing and not fair to the patients, but it's also a great way to miss something serious. What if it was a septic arthritis in the knee? Or, like
Yeah.
what if they tore their ACL, meniscus, or whatever it may be? But we were just like, well, if you lose some weight, you could get that off. And so I think, unfortunately, weight bias infiltrates every aspect of healthcare. And I think that unless you check your bias and really evaluate if you do have a bias towards those who may be living in a larger body, then you will not be able to provide the best care.
Yeah, and I think I'm going to link this, but there was a 2012 study in Obesity Reviews, like a journal, that physicians spend less time providing less education, showing less respect toward patients with higher body weights. And this has been shown in pediatrics too. And you said it perfectly. And a lot of the times, the assumption and misconception, I think, coming from some of these clinicians is that they're not going to change, or what's the purpose, right? Like, what are we going to do here? So, not only, like you said, are we missing valuable things that we are dismissive of like, hey, this could be something more, and you're also not providing that education. I do it because I want to educate all my families, but that is a huge loss to the patient doctor relationship, and also just to
Yeah.
the health of the person. I mean,
Right.
and then they're less likely to seek care in the future,
Right. And
which
when
is
in reality, these patients probably need more of our time, right? Like
yes.
they are already feeling stigmatized and not wanted and not worthy by the entire world. Then to feel that by their doctor, like that's not okay.
Yeah. And then my last big kind of topic is these harms of these labels in general. Like, you obviously talked about how it can we talked about how it can create an unhealthy relationship with food. Anything else you'd want to add to the harms of these labels, like obese or underweight, as it, whether it's from the medical community or whether it's from just society?
Yeah, Mona, I think you and I both could. I hate to speak for you, but just based off what you've said so far, one example would be body dysmorphia, right?
Hmm.
And so I talked about my weight as a child being very large. And even though I'm fit and active now and stay relatively lean because of my activity level, I still struggle with that, right?
Yeah.
Like it's insane. But I go to the beach with my family, and I'm apprehensive to take my shirt off at the beach, right? Like in
Yeah.
what world does that make sense that that I had to be judged so hard as a kid that I still deal with some of that trauma today, right? And so I think that is a huge aspect of it. And whether it be a larger body or a smaller body, like I have had patients who may be living in a thinner body who will wear very baggy clothes because they don't
Yeah.
want people to comment on how thin they are. And so I think that body dysmorphia is a could be a result of that, and then also anxiety and depression. We see those rates go much higher in people who deal with these issues as well. And so I think it impacts like our entire health, not just our physical health, but our mental health, our emotional health, our social health. So I think it impacts every avenue of health, and it has to be something that we work towards improving.
And I pulled some stats and data because I was very interested in this topic. And one of the things I saw is that children as young as 3 years of age internalized weight-based stereotypes, which is why I think we're having this conversation about the medical system, because a lot of this is coming from the medical system when we talk about percentiles, talk about weight, talk about nutrition in the office to a parent who then can pass that on, right? So, for example, if a parent's coming in hearing from a respected person like a doctor, like your child is overweight, your child is underweight, your child is X, Y, and Z as a label, then the parent can start to do things at meal times and like restricting or
Right.
pushing, all the things that we're talking about. And again, that can contribute to the unhealthy relationship with food. You talked about the depression, disordered eating, which, yes, that is absolutely reality. And I'm going to attach all of these links of data that supports this. We talked about delayed care, because if there's a stigma, right, like that they're not going to want to show up to these visits. And then my thing always goes back to that psychology. If I'm actually going to want to make an impact in someone's life for health, I got to not shame them to start the conversation, right? Like,
Right.
it is common sense in anything. In anything, I mean, to me, it seems natural. But if I'm going to get through anybody, to call them names and say, well, you don't do this or you're this, whether it's about vaccines, whether it's about weight, whether it's about whatever approach we're doing, shame is not the answer. It's
Right.
collaboration. It's, hey, I'm on your team here. And I have some little phrases that we can throw in on, like, how you can kind of empower yourself in the waiting room, and like when you're going to these visits. And I want to throw these in too. Like, if you are finding yourself in the situation where you are trying as a parent to create a healthy body image, and your doctor may do a lot of something different, remember that you can advocate for that. You can say things
Yes.
like, I prefer we avoid terms like obese or overweight in front of my child. We're working on supporting body confidence at home. What other markers are you seeing in my child's growth or labs that gives you concern or reassurance? Like, what are the good things? Can we talk about the
Right.
good things? And then sometimes doctors, bring up things like weight in front of the child. So if they do, you can talk to your child before or after in case that wasn't expected and say, I want you to know that your body's not the problem. And we're going to focus on how you feel, not just your numbers, right? Like, and that should be something that we as medical professionals should also be doing. So I hope that people listening are not just parents, but also medical professionals, because I have seen this and I'm like, no, 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 no. I'm taking this overweight thing off your chart. Like, I don't want this on your chart because there's no label needed here. Like, you're not overweight. This is your body and you're doing the things we need to do. If there is an issue of high cholesterol, I will have to mark that down. But it means that we're going to work towards it with a lifestyle, And I think that's
Yeah.
so key.
Yeah, that's I think so important. And one last thing I want to say to the parents is that one of the number one ways that you could help your child, and it has nothing to do with you talking about their weight or their size, but is by you actively living out the lifestyle and doing it together as a family. And so,
I love
whether
that.
that be that you guys go on a family walk together, or you guys cook a dinner together, and you teach them that you're cooking vegetables and you guys are eating fruit and lean meats, not fried in oils and things of that nature, that you guys do this as a family and you make it fun together, so that then you guys create this healthy lifestyle. And not only is that going to benefit your child's health, but also your family's health, your partner's health, and hopefully do it in a way that you guys all enjoy and thrive together.
I love that. It is a family approach, like the modeling, all of it. Well, that was going to be my last question about the final uplifting message. So would that be your final uplifting message, or anything else that you would like to tell our listeners before they go on with their day and feel empowered to talk about health and not numbers?
Yes, of course. I think my uplifting message would just be what I would tell my 10-year-old self, and that is that your value and your worth is not tied up into your weight, your size, the number on a scale, or the size of your jeans. It's not tied up in what the world may say to you or how society labels you. So please ignore all of those comments that you may hear. Focus on what your body can do and challenge your body to do things that you're maybe unsure if it can do. And then you'll surprise yourself when you strive towards those and accomplish them, because I promise that you are so much more powerful and stronger than you could ever imagine, and definitely stronger than what this world has told you. So do not listen to the labels. Do not allow the weight or scale to define your worth, and know that you are extremely, extremely valuable and capable.
I feel that so strongly, and I just love this conversation. I know we're going to have more episodes. I know you have a podcast, but tell us where
Yes.
everyone can go to stay connected, including your socials again, and also your show, your new podcast. So tell us more.
Yeah, of course, Mona. Thank you so much for having me. So, if you want to stay closer connected with myself and what I do on social media, my handles are just Dr. Tommy Martin, pretty much on every single platform. And then I have a podcast that just came out 2 weeks ago called We Are Human, where we dive into the lives of those who work in healthcare but do not allow healthcare to define them. So,
Wow.
highlighting their passions and what they pursue outside of medicine while staying human in medicine. Would love to connect with you guys. So, hope to see you guys on my channels.
I will be attaching all of that in our show notes. And again, you really must follow Dr. Tommy. Like I said, not only is he good at educating, but he's just a happy person. And I know life is tough. I mean, that's what I like. Dr. Tommy's not immune to life struggles, but he just gives the world a lot of positivity, even when he talks about hard things. And I try to do the same thing as well. And so I love seeing fellow physicians really trying to uplift people with positivity, being real when we need to be real, but also showing life struggles and really empowering not only adults, but children, being a medical, internal medicine and pediatric doctor. So thank you, Tommy. I'm just so excited we could connect today.
Hey, same. Thanks for having me, Mona.
And for everyone tuning in, please make sure if you like this episode, share it, put a thumbs up sign, and also subscribe to our channel, because I have a lot of amazing guests coming to the show, just like Dr. Tommy, and I'll see you all next time.